Welcome to my presentation. My disability presentation is about oppositional defiant disorder. I will explore its symptoms, some of the causes, and successful plans for management. Oppositional defiant disorder is children showing a pattern of uncooperative, defiant, and hostile behavior towards teachers, parents, peers, and other authority figures. Recognizing and acknowledging this disorder is very important in children getting the help that is necessary. Oppositional defiant disorder incorporates an ongoing pattern of irritability, anger, arguing, and defiance to authority and parents. Children will seek revenge and are mean to their peers and others. The exact cause of ODD is not yet understood. Research suggests it is caused by a combination of environmental, biological, and genetic factors. Genetic. Some children may have the natural likelihood to develop ODD because inherited traits that affect emotional regulation and temperament. Brain chemistry and function differences in the structure of neurotransmitters and balances may play a role to behavioral issues. Environmental factors, family, life, inconsistent discipline, and parenting style can increase the risk of ODD. Environmental factors matter. They influence everything from diseases we get to how we behave and interact with each other. Understanding these factors is crucial for promoting healthy lifestyle and addressing public health challenges. Psychological and social influences play a role in developing ODD. Children who have had a hard time forming healthy relationships and struggle with emotional regulation may develop oppositional behaviors. Negative reinforcement factor. Repetitious negative authority interactions can reinforce defiant behavior. Risk factors of oppositional defiant disorder includes family history, where genetics can play a factor, exposure to abuse or neglect, where there violence, where they're exposed to violence, inconsistent or harsh discipline, where the parent may discipline this time, may not discipline this time, the parent may discipline this way, they may not discipline the same way. Or it could be a harsh discipline where it goes back to violence. Coexisting conditions like anxiety, ADHD, or mood disorders. The effect of ODD could be academic problems, social challenges, mental health issues, and substance abuse. ODD can be mild, moderate, or severe. Mild ODD will be considered if the child is having symptoms in one setting. Example is either in the school or in the home. Moderate ODD would be considered if the child is having the symptoms to occur in two settings: school and home, or home and the church. Severe ODD would be if the child was having symptoms to occur in three or more settings. Example would be home, school, and with peers, or home, school, and in church. Diagnosing a child for oppositional defiant disorder. Early prevention may often avert problems in the future. A child's healthcare provider oftentimes will want to eliminate other problems. After eliminating other problems, a qualified mental health specialist will be able to diagnose for ODD. The professional will meet with the child, the parent, and the child's teacher. All possibilities are important to investigate before making an appropriate diagnosis. Most of the symptoms of children with ODD happens in other children that doesn't have ODD. Children with ODD are more severe and defiance happens often. It can affect learning and relationships. Symptoms must be present for 6 months in a child. The child's provider will decide if the child's behavior is normal behavior suspected for their developmental level, gender, or culture. Extreme defiance can occur because of other situations. It also can be a sign of an undiagnosed learning disability. Some of the symptoms could be talking unkindly, easily annoyed, oftentimes having an angry attitude, being vindictive, refusing and questioning rules, arguing frequently with adults, frequent temper tantrums, not doing what adults ask of them, annoying others, and blaming others for misbehavior or mistakes. Most of the symptoms of children with ODD happens in other children that does not have it. But the difference is children with ODD are more severe. Treatment for oppositional defiant disorder in a child. Future problems can be prevented by early treatments. Treatment depends on various factors. It depends on the age, health, and the child's symptoms. It also depends on the severity of oppositional defiant disorder. Many of these symptoms may be caused by other mental problems. That's why it is imperative for a child to see their healthcare provider for proper diagnosis. In order for treatment to be a success, you will need collaboration between the school, family, and healthcare providers. Children may have to try various therapies and different type of therapy to find out which works best for them. Treatment may include cognitive behavioral therapy. The child learns to better communicate and solve problems. They learn to control impulse and anger. Family therapy. It helps to make changes within the family. It helps with the family communication skills and the family connection. Parents and siblings need the encouragement. Dealing with children with ODD can be very challenging. Peer group therapy. The child learns better social skills. Medicine. Medicine is not a common treatment. It may be needed for other symptoms of the disorder. Oppositional defiant disorder is a disability that needs early intervention, diagnosis by a professional, and therapy. There is hope for a positive outcome with the right treatment. There are different types of ODD. Patience and understanding can help with a successful outcome. I hope you guys enjoyed and I hope you guys learned a lot. Thank you.